This is the hanging back swing characteristic. This characteristic is very easy to identify. Basically take your normal setup posture and draw a line from your ankle joint straight up vertically. Now, as you swing back, you'll notice you usually move away from this line, creating a bigger gap. In transition, you should close the gap and turn into impact. However, you're deemed to be hanging back if you don't close the gap. In some cases, the gap will get even greater. But if you don't close this gap, you're deemed to be hanging back.
We're talking about hanging back. Now, hanging back is one of those swing characteristics where really you're just avoiding one side of your body. You're staying back here on your trail leg and you're not getting forward. Now, this can be due to a technical problem or a physical problem. We always say the first step is figure out which one it is so you know what to attack. What I want to do is I want to show you maybe a couple tests that you can look at to see if your body is part of the problem. Now, there's so many things that can cause hanging back. I'm just going to highlight two. First one is maybe you're not strong enough or stable enough to shift your weight onto your left side to be able to post up and stabilize, so you just forget about it and just stay back here on your back leg. The second thing is maybe you don't have the mobility. Maybe you can't get onto your left hip and rotate around your left hip because you've got hip mobility problems. We need to check both of those. Let's go after the hip mobility first. We do a test called the cigarette butt test. It's really simple. It's like throwing a cigarette on the ground. You're going to take your foot and you're going to put out the cigarette. What I want you to do is I want you to keep your feet pointing forward, take your left hip, we're going to put your weight on your left heel, and you're just going to turn that foot in just like you're putting out a cigarette. You should be able to turn that foot in at least 40 degrees. Okay? 40 degrees is the mark here. But I want you to just compare. You can compare your left to your right. If you notice one side is hard to move and the other side is good, then you have a physical problem. Really important for the hanging back is that lead side needs to have good what's called internal rotation. So you should be able to do that very easy, 40 degrees. Second thing is strength. We want to see if you have the stability. To check that, we're going to do something called the bridge test. Let's go ahead and lay on your back, hands up. Now from here, you're going to lift your butt up in the air. Get your pelvis nice and level. From this position, I want you to straighten out your right leg. Now all your weight's on your left leg. This is that area that we want to make sure is strong enough. Keep your pelvis up, hands up, and you should be able to count to 10 seconds. This should be incredibly easy. If you have any discomfort, if you feel like your hamstring is going to cramp, if you feel shaky, if you feel like your right hip is dropping, then this is definitely not strong enough, not stable enough. It might be one of the reasons why you're hanging back.
This exercise is flow row perpendicular foot. What we're going to do is take a cable system, keep it nice and light, and I'm going to step out with my foot perpendicular to the resistance. Now from here, I'm going to stand on my lead leg, I'm going to rotate towards the resistance. This is internal hip rotation on my lead leg, and then I'm going to rotate externally and row. Decelerate internally and work externally. Your whole body moves as one piece here, and a great exercise for lead hip internal and external rotation. This exercise is a side wall press. What you want to do is stand next to a wall with your feet and shoulder width apart, shoulder against the wall, and then just take your inside leg, bring it up towards the wall, bent 90 degrees, and then push it into the wall as hard as you can. The outside leg has to be soft, so just soften that knee and push as hard as you can with that leg against the wall. Push, and you're going to have to resist. You want to feel this in your glute medius, this area of your glute right here. If you start to feel it in the front, you can move this leg around until you get it right in the right spot. Great exercise for glute activation for the gluteus medius. This exercise is called pivot and post, a great exercise for weight transfer, making sure your golfer gets on their lead leg. For a right-handed golfer, take the FMT band in your left hand, put it on your right hip, and just turn around in a circle. From here, pivot onto your lead leg and post up. For a left-handed golfer, we just do the opposite. Put it in my right hand, go around a circle, and again, good golf posture, hand across your chest, pivot, and post.
This is half kneeling bounce pass. What you're gonna do is you're gonna get a medicine ball, and I like one that bounces but not too easy, something where you have to use some effort to make the ball bounce in the air. Jason's gonna demonstrate here. You're gonna get down in the half kneeling position. Now you're gonna bounce towards the knee that's down. Take a medicine ball, we're using a 6-pound medicine ball here, and Jason's gonna demonstrate. You're gonna hold it up over your right shoulder, and you're gonna bounce it straight into the ground and try and get it as high as you can. You wanna really try and make them bounce over your head. So when you're doing this at home, you try and bounce this thing into the ceiling. Good, notice how good he's staying stable in his posture. There's no slouching, bending forward. And what you really want to do is you want to try and start moving backwards so you can kind of bounce it behind you, almost 45 degrees behind you. And then we would go ahead and switch and get the other side.
This drill is called Impact Fix. This is a great drill to help those of you that cast the club or get into what we call a scoop position at impact. So basically what you do is you take your normal setup position. In your setup position like this, I want you to go to what is your impact position. Now notice they are quite a bit different. Setup position looks like this, but at impact, all great players have a forward leaning shaft, have their hips and chest open to the target. When you're in this position right here and you get into a good impact position, I want you to get in this position first. I want you to go into your backswing and focus on just returning to that position. This is a great position to get the forward leaning shaft, to retain the angle in your wrist, to stop that cast and stop that scoop. It's a great drill to help you strike the golf ball better. This is called the lead leg drill. This is a great drill to help those of you that slide. If you're a slider, then your lower body moves excessively towards the target on the downswing. So what we want to do is stabilize into this lead leg. To do that, all you're going to do is stand on your lead leg. Stand on your lead leg, raise your trail leg, and just put your weight on your toe. So now majority of your weight's on your lead leg. What I want you to do is make some smooth, controlled swings, really feeling like you turn your front pocket where your back pocket is. So you're going to learn to turn and post up into this hip. If you're one of those players that sways, you might even fall over when you try this. It's a great balance exercise. It's a great drill to help you stop your slide.